Hello, good morning, Dr. Garcia. This is Nurse Angelica from the Emergency Department. I need to report a patient condition.
Alright, go ahead.
So, Doc, I am calling about Mr. Marupok, a 24 years old male in the ER with fever, chills, and breathing difficulty for 10 days. His temperature peaked at 101.5 Fahrenheit, and he reported body aches, fatigue, headache, sore throat, and congestion, and appetite loss. His condition is worsened despite of paracetamol.
Has the patient experienced any severe respiratory distress, such as shortness of breath at rest or worsening symptoms when lying down?
No severe respiratory distress at rest, but he reported increased fatigue and difficulty breathing with exertions. The patient attended a party where a gas leader tested positive for COVID-19. He reports loss of smell, 10 pounds weight loss, and muscle resourceness. His history includes childhood chicken pox but no other conditions. He smoked 2 packs daily and drinks occasionally and lives alone.
Based on our records, Mr. Pock has not been hospitalized before and has no known chronic illnesses. However, his history of smoking and recent exposure to a COVID-19 positive individual increases his risk of complication. It would be best to rule out pneumonia and potential secondary infections. Has the patient received any COVID-19 vaccination or booster shots?
He stated that he received 2 doses of vaccines over a year ago, but he's not had a booster shot. Based on my assessment, the patient shows signs of possible viral infections, likely COVID-19 or influenza, with sinus involvement, so his breathing difficulty and dehydrations are concerning. True vitals are stable, his symptoms, weight loss, and exposure history such as possible secondary infections or pneumonia, requiring urgent evaluations. I recommended a full respiratory assessment, including a COVID-19 swab test, CBC, chest x-ray, and blood cultures. He may require IV hydrations, symptomatic treatment, and antibiotic if a bacterial infection is suspected. Would you like me to initiate isolations protocols and start oxygen therapy if his oxygen saturations drop, Doc?
Yes, Nurse Angelica, go ahead with the COVID-19 test, CBC, and chest x-ray. Start IV fluids and monitor his oxygen level closely. If his saturation drops below 94%, initiate oxygen therapy. Additionally, start empirical antibiotic therapy if bacterial infection is suspected. Keep me updated on any changes.
Understood, Dr. Garcia. I will proceed with this order and keep you informed.
Okay, thank you, Nurse Angelica.